And in light of that new strain in the United Kingdom, there are fresh guidelines that have been issued for international airports. Health Ministry has issued a new set of SOPs for UK returnees. Okay, so the screening of passengers who are returning from the United Kingdom has been stepped up at various airports, and the Health Ministry has now issued a new set of guidelines for all those coming back from the United Kingdom. All passengers have to provide their travel history, and an RT-PCR test is mandatory for all UK returnees. My colleague Shireen joins us for more details on this new guideline which has been issued from the Health Ministry. Shireen, just can you take us through the key takeaways, the key highlights of this new SOP?
Well, this SOP that has been issued by Health Ministry is in keeping in view of the new mutant variant of coronavirus that has witnessed in United Kingdom. Now, there is 3 parts in which this SOP has been divided. One part is the SOPs that has to be followed by the international airports in India. Second is the SOPs that need to be followed by the Bureau of Immigration. And third is something that needs to be followed by the state and the district surveillance that will be done. Now, remember, already the Civil Aviation Ministry has yesterday announced that they are going to ban the flights that is coming from to and fro from United Kingdom starting from 23rd December till 31st December. Now, 21st and 22nd, there are a number of flights that are going to land in Delhi from UK, and there are certain rules that has been SOP that has been put in place by the Health Ministry. That is a mandatory RT-PCR. Now, anyone who has traveled to UK or even transit to UK had to go through this mandatory RT-PCR test. And if it's negative, the person can go for home quarantine for next 1 week. But if their tests have been proved positive, then they have to go for a gene spike test. Their samples will be sent to NIV Pune. Now, the gene spike test basically means the genome test basically means to detect if there is elements of for the new mutant variant of coronavirus that the United Kingdom has been talking about. And in case that is found, there is going to be, of course, in case if the person is positive as well, they have to go to a government institutional facility that is being made available by the government for the people. Secondly, the Bureau of Immigration has to ensure that the list of travelers have to be given to the state. Now, the state duty becomes very, very important because remember, the United Kingdom has also said that the new mutant variant has emerged in mid-September. So since mid-September, a number of people have in fact landed in Delhi, in India. So the responsibility of the state and the district is going to be surveillance of contact tracing of such people and to get them tested. So these are in 3 parts. It has been divided. And also 21st and 22nd. Now, tomorrow is when the flights are banned to and fro from UK. But till tonight, passengers from UK can come. So it is going to be very important. People who are going to be landing in India have to go through a mandatory test, and thereby has to go through a gene spike test that will in fact detect whether a new mutant variant has entered India or not. Apart from that, there's also going to be contract tracing that will be done by the state and district level.
Okay, Shireen, thank you so much for that very thorough key highlights of these new guidelines. To discuss this further and the level of threat that this new strain poses, joining us this afternoon is Dr. Shashank Joshi, who is the Dean of the Indian College of Physicians at the Lilavati Hospital, as well as the member of the COVID task force in Maharashtra. Dr. Joshi, thank you so much for joining us. We appreciate you taking out time. My colleague Shireen was just explaining to us the new guidelines, the procedures that are in place at these various airports. Now, one thing that she mentioned, of course, was those who are tested positive for COVID at the airports are going to have to go through a separate test to find out whether they have this new strain. It is going to be a while, isn't it, till we know whether there is this new strain which has already made its entry into India. And secondly, given the fact that the strain was first identified in September, and we've seen so many flights coming into India since then, so many people coming to India from the United Kingdom till then, what threat does this pose?
So I think let me answer both your questions. Let me answer your second question first. Thank you for having me on your show. That you said that the strain was first coming out around 20th of September. And between 20th of September and now around 20th of December, almost couple of months have passed. But there is nothing to panic. This strain is a originated strain which came from the Kent County in the southeast area of UK, then went to London. And it has infested east of UK, southeast of UK, Kent, London. And from there, if people had contracted it, it's most likely the numbers went up only in the last 2 to 4 weeks, when UK has now recently last week put out a tier 4 alert. So most likely we will have to be vigilant on all the people who have come from UK in the last 2 weeks. We will have to be vigilant. We'll have to be cautious. We will have to do some amount of surveillance. And this is a byproduct of the genome surveillance. So they have actually done gene sequencing, and it is unlikely that a large number would have come to India. Nevertheless, even if a few people have come in carrying and harboring the new strain, we will have to be cautious and careful. If they get symptomatic and they transmit it further, we will have to evaluate them, investigate them. And that is why all our investigating agencies from the public health side, including National Institute of Virology, Indian Institute of Genomics, they are all ready to do this new gene sequencing. So it will only time will tell whether this has come or not. But we are taking measures as a way of abundant precaution because we need to be cautious. The main thing which is worrisome, first of all, there is no need to panic because it has not been clinically proven that it is more severe disease. So please don't panic that this is a more fatal disease or a severe disease. So there is nothing to panic on that front. The only thing is that it spreads fast. Its transmissibility, that too based on an indirect mathematical modeling, has been shown that it probably is 70% more transmissible. And the R0 from 0.39 went up to 0.80. So the R0 moved up. And that is why people have got a little scared and a yellow signal has been put out. So we need to be cautious. We need to be careful. And it is possible that some people might have seeped in with the strain. Hopefully they would have recovered. It just behaves like any other COVID infection. Currently, we don't have any clinical data to show that it behaves any differently. It causes worse disease, severe disease, or deaths. So please don't panic about this.
Very important message you've sent all our viewers. Don't panic. And also, I appreciate you explaining to our viewers why need not panic. Now, there is also concern that after such a long wait, there has been a vaccine that has been found. In fact, that was a reason to look forward to 2021 as well. Now, with this new strain, how do we reconcile ourselves with the new strain and a vaccine that has been found for the old strain?
So remember, the test of the vaccine of the old strain is already happening in United Kingdom. Remember, the vaccine which most people in UK, the doctors and the senior citizens have got, is the vaccine developed based on the old strain. See, this current mutation is only on the spike protein. But by and large, the vaccines which have been developed will take care into account because all viruses, including flu viruses, COVID viruses, their mutations are well known. So right now, it is unlikely to impact the major vaccine developed, and therefore it will not impact the vaccine program. So again, that is another cause of worry people have, that will the vaccine program be hit? I don't think so. But the next generation vaccine, because remember in flu vaccine also every year we make a vaccine from southern hemisphere of Earth and northern hemisphere of Earth. Similar to that, the COVID vaccine every year based on the strain will undergo a change. So next year when they do the vaccine, they will keep into account this variant. If this variant survives and spreads across the world and becomes a very popular strain. Right now it is not a popular strain, it is a rare strain, but in some pockets of United Kingdom, it has assumed proportions beyond 50%. This is called genome surveillance. Remember, a similar strain like this in September came in Singapore. But what Singapore did is they actually squashed out the strain. They completely locked out totally and they masked. So remember this, if you really want to break the chain of transmission, we need to mask appropriately. COVID appropriate behavior has no substitute and vaccines will not be impacted immediately because of the emergence of this new strain.
Okay, that's going to be very reassuring for all our viewers. Dr. Joshi, thank you so much for joining Mirror Now and really busting some fears that have been, I think, are in people's minds as a result of this new strain.
Thank you.